Hello. Have you ever questioned how you're going to pay for your doctor's appointment? Or maybe if you could afford to go to the dentist? Sadly, this is something over 50% of Oklahomans experience every time. Today, I will discuss how Oklahoma should implement a policy to provide more affordable health care for those who lack insurance, jobs, or on low income families. Before we go further, I would just like to say this topic is very sensitive and we've almost all experienced it. So my heart does go out to who experienced it, and hopefully we can have significant change. The biggest problem is that Oklahoma has low access to healthcare due to the high costs. The increases in insurance premiums cause these high costs, along with others being uninsured and those who are insured pay more to compensate for the losses. Emma Murphy uses a quote from Glenn Mulready, the commissioner of Oklahoma's Department of Insurance, saying, "Leaders and citizens need to prepare for the consequences of these subsides ending with significant changes in health insurance costs anticipated," expressing the worry about these costs. Mulready also exclaims that over 300,000 Oklahoma residents have experienced increases in prices up to 75%. However, however, those who do have access to healthcare within Oklahoma may not be receiving the most high quality care. It has been known that Oklahoma residents often don't experience as high quality care as other states. This is caused by many rural areas not being properly staffed with the correct amount of healthcare workers that are needed, or just overall benefited from. Um, this issue is often because it is such a rural area, and especially with the increases of prices, it is hard to pay these workers, and the overall prices of medicine and medical resources affect the quality of care many receive. The Commonwealth Fund says Oklahoma consistently ranks low in the national comparison of healthcare access, specifically 49th out of 50, which is pretty low. It's been inferred that our state's overall literacy on health care is lower than usual, which is leading to the poor quality of care. With these last two reasons in mind, I believe Oklahoma should implement a policy to provide access to affordable health care for individuals who currently lack insurance, are unemployed, or belong to low income families. There has been previous efforts to address this issue, such as the Affordable Care Act or ACA, um, the the reality is that it was truly successful for a certain amount of people in a certain amount of time. But we need to take more steps to affordable healthcare affordable care healthcare that still remains unmet. Cities like Oklahoma City and Tulsa coverage, um, have taken steps towards getting this covered, but the challenge still persists. The American College of Physicians once said, "The ACA will make health insurance more affordable, providing health insurance and tax credits and cost sharing to the uninsured, um, underinsured, and small businesses." These were bold and hopeful promises made by the organization, and while the ACA did help millions across the country, they have fallen short for many Oklahomans, especially. Insurance premiums still remain high, coverage is often limited, and navigating the system can be so overwhelming, especially for those who have limited income or unstable employment. Um, this is why a new state driven policy is urgently needed. By expanding access to affordable health care um, through targeted reforms such as Medicaid expansions, Medicaid expansions enhance subsides and development of community health networks. We can immediately change the lives of hundreds of thousands of people within Oklahoma, especially. For many, access to affordable healthcare can mean earlier diagnosis, better chronic pain condition and pain management options, along with fewer emergency room visits, and overall peace of mind knowing that if something happens, you are covered and you are taken care of. Healthcare is not just a service, but it is a lifeline to many, especially with children and big families. And it's time for Oklahoma to ensure that no one is left behind. In conclusion, Oklahoma should implement a policy to provide affordable healthcare for all Oklahomans uh, by offering healthcare so many people can stop paying for insurance premiums, and we can prevent situations where people are um, forced to rely on um, in, not good care, or worse, than go without care altogether. Even everyone, regardless of their income or employment status, deserves adequate care overall. You should be able to go see a doctor, fill a prescription, or live without worrying when you're going to be helped next. Let's not wait for this crisis to force change. Let's choose to lead with compassion and common sense and start now. Thank you.